Hi there and welcome back. Let's review coronary risk factors today. In order to understand the coronary risk factors, first we need to understand what is epidemiology. So, epidemiology refers to the study of the determinants and the distribution of the disease. The focus is who gets the disease and why. Is there a particular trend? Is it amongst the rich or poor, aged population versus young population, black or white, things like that? Is there anything that has to do with a genetic trait or uh, any other factors like a lifestyle change, things like that? What is causing? Is there a way we can prevent the disease, or is there a way we can better control and manage the disease, and if so, why? All these things boils down to what is called epidemiology. There are data and research that reveals that, say for example, high blood pressure or high cholesterol, that can be quantitatively and qualitatively differentiated from the remainder of the large population that remains healthy. So these predictive pre-disease characteristics are labeled as coronary risk factors. Let me write that down here. Predictive pre-disease characteristics is labeled as coronary risk factors. So with that, let's take a look at that we are going to be encountering frequently in our daily routine. What are these coronary risk factors? And before we proceed, one important factor or the element to consider is this, that a coronary risk factor is a characteristic that an apparently healthy person may have, and it simply means that he has a statistically speaking higher probability of developing that particular disease, but there is no guarantee that he will have that disease, nor does it mean that if he doesn't have, he is immune from that disease. So remember, bottom line, we are dealing with insurance, law, large number, statistics and probabilities. Okay, so with that being said, the first comes on the laundry list is the age. Age is the most important coronary risk factor, and age is the number one. You can think this way, that you would rarely see someone in the age group of 20s with a coronary disease. So age is the first and foremost considered as the coronary risk factor. Second is the gender. There are statistics to prove that generally speaking the overall mortality rates are higher for males than females. Cigarette smoking, the single most important environmental factor that contributes into the development of the coronary disease, not to mention about damaging the inner wall of the vessels, but besides that it just adversely impacts the blood pressure, it increases the LDL or the bad cholesterol, decreases the HDL or the good cholesterol, and it just multiplies and accelerates when it boils down to the mortality in the development of lung cancer. Next on the list comes the elevated blood pressure, and there are statistics to report that relatively speaking greater among males than females and at a younger rather than older ages. Another Coronary risk factor would be serum cholesterol. You look at the total cholesterol, HDL cholesterol, LDL cholesterol, or the total cholesterol to HDL ratio. That is labeled as coronary risk factor. Family history we have discussed in the past. So as you know by now that is another important coronary risk factor. Obesity, overweight. So there are statistics to indicate that at both younger and older ages, there are concerning data due to the obesity. The mortality rate is statistically speaking greater when compared to central or abdominal as opposed to the peripheral fat deposition. So that's about the obesity. Then glucose intolerance, we have discussed this in detail while reviewing diabetes. Elevated triglycerides, another factor to consider, but remember, are you dealing with fasting or non-fasting? Because reliability absolutely depends on being on the fasting basis. Lack of physical exercise, no need to elaborate further. We all know that the greater the level of physical fitness, the better the survival. Heart rate or the pulse rate. So increased heart rate is statistically proved to be associated with poor survival. The next on the list is low vital capacity, and especially in women and elderly. The next is sleep disturbance, snoring, sleep apnea. And next is microalbumin in the urine even without diabetes and hypertension. So just because someone does not have diabetes and hypertension doesn't mean per se microalbumin in the urine is a coronary risk factor. Needless to say, stress, anxiety and depression plays a role in a coronary risk factor adding to the coronary disease. And last but not least, look for the CRP. That's the marker of inflammation. So the point is that we need to correlate. Sometimes we are looking at a micro level underwriting. We don't correlate and look for the combination or the combo debits. So look for the macro underwriting. Follow your underwriting manual and your company specifics to arrive at the best possible rate class without adversely impacting the bottom line profitability and or your client's experience. With that being said, let's stop here and we'll see you soon. Take care. Bye now.